Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up, we're leading with our chin, specifically our double chin. This week, the FDA approved a first-of-its-kind non-surgical treatment designed to melt the fat off. Holly, tell us about that.
Right, well, so this is an injectable drug. It's being called Kybella. It's not surgery. And it's actually a synthetic form of a compound we already have in our intestines. In our intestines, it helps to break down fat from food. In this case, it's being injected into the area under the chin to break down fat there. What it does specifically is it dissolves the cell membrane of fat cells, essentially destroying them in the process.
What are the side effects, and really does it work? That's what I really want to know.
You know what? So I spoke to one of the doctors who was involved in the clinical trials. He said the results were overwhelmingly that it was, in fact, effective. But you know what? This is quite a commitment of a procedure, right? It's done over the course of 6 months with monthly injections, sometimes 50 at a time. So, of course, if you're getting 50 injections under your chin, you would expect redness and swelling. But there were some other side effects reported, like difficulty swallowing, or some people reported facial weakness. Those things resolved, but those are still serious concerns.
As a doctor, John, when somebody tells you they want to change their appearance, what do you tell them?
Well, if somebody comes in and they feel very strongly they just want to do this, and they're psychologically intact and they're medically intact, then I'll go along with it and I'll back them up on that. On the other hand, a lot of times people come in and they're not quite sure. They go, what do you think? Do I need something? Do I need something? And then I try to do a little bit of a deeper psychological dive. Why are you doing this? Is that you're trying to achieve some sort of an ideal that's really not realistic based on things that you may see celebrities have on magazine covers? And, you know, Cindy Crawford famously said, even I don't wake up looking like Cindy Crawford. You know? And I actually spoke to her. I just spoke to her because I wanted to know, was this urban legend? And she said, yes, she did say it. She wasn't talking about retouching. She was talking about the fact that when she wakes up, she doesn't look like she eventually will look after hair and makeup. And by the way, the lighting. And she said, you know, they may take 200 pictures of me and then they pick out the best one. Right. And the reason why she was so excited about doing this was she said, you know, as a girl, you like to dress up, do hair and makeup because it's kind of a fantasy. And she likes to think it inspires women to do the same. But if you start off feeling badly about yourself and you see these pictures, it may make you feel even worse. So I think you have to say, where is it coming from and exactly why are you doing it?
Nice to hear that from a supermodel, too, right? Yeah. Well, the American College of Physicians has new best practice guidelines to try and avoid too much cervical cancer screening. So what is this about?
Right. You know, what's interesting, these are not new guidelines. These guidelines were sort of reissued as a reminder to physicians not to over-screen for cervical cancer. Screening can start at the age of 21. At that point, you get a pap smear every 3 years. At the age of 30, you can start screening every 5 years, and you add an HPV test along with that. And for some women, by the time they reach age 65, they don't need to be screened again for cervical cancer if they've had negative results leading up to this. It's just a reminder that more in this case is not necessarily better based on years and years of research.
So, John, what are the consequences of overscreening for cervical cancer?
Well, the test itself, of course, can involve some anxiety and discomfort and cost. Yeah. And then if you have a positive result, you can end up needing a biopsy. That biopsy can lead to some bleeding and infection, either other complications, certainly pain. And then there's the question of false positives. Was it really a positive, or was it a misread or some problem with the test? And then even if it's a true positive, even if people actually have HPV, which is the virus that ends up causing cervical cancer in some cases, 90% of people who have HPV infection clear it on their own within 2 years. Right. So if you just wait, it can go away in 90% of the cases.
All right, this week, federal health officials recommended cutting the amount of fluoride in drinking water for the first time in more than 50 years. John, why are health officials recommending this change?
Well, they're tinkering with the recommended dose. I mean, this was the initial amount that they recommended. Now they realize years later that people have a lot of fluoride that they ingest in toothpaste and in mouthwash. And if you have too much, you can have something called fluorosis, where you have some abnormal white markings and even rarely some pitting of the tooth.
Why is the government continuing this practice then?
You know, it's really a hot-button issue, Vanita, and I actually see logical arguments on both sides. You know, on one hand, we have to acknowledge that putting fluoride in drinking water was one of the greatest public health achievements and services that there has ever been. It completely changed dental health in this country. It really dropped the level of decay for both adults and kids, and is still doing that now. It's also a great equalizer. You know, at that time when it was first introduced, many people could not afford dental care. They couldn't afford to get to the dentist. Today, many people still can't. You know, on the other hand, though, even though we have a large body of evidence showing that small amounts of fluoride in drinking water are not harmful, I think it always makes sense to continue to mount that evidence, to continue to make sure that whatever we're doing more good than harm.
My 96-year-old dentist father, who is at home watching this right now, I'm sure, would not forgive me if I didn't point out that it's not a replacement for doing the flossing and the brushing and all that usual stuff you're supposed to do.
A new study highlights the potential health benefits of a very simple activity. Walking. Did we really need a study to remind us that walking was good for us?
You know what? It's one more little reminder that sitting itself is dangerous. This was an observational study. It looked at 3,000 people. And basically what they did was, for every hour that they were sedentary, basically for every hour they sat, they stood up and just walked for 2 minutes. They weren't power walking, they weren't jogging, they just walked for 2 minutes. They found that it decreased the risk of all causes of death for those people by 33%.
Wow.
And even more for the people who had kidney disease.
Just 2 minutes.
Just 2 minutes. So it's just a reminder, it's not only about getting your exercise or getting out to the gym for a few, 45 minutes a day. If you're going to sit for 8 hours straight, that in and of itself has risks.
Right. So simple.
In evolution, we didn't sit around a lot. We were moving around. There's something about the act of staying sedentary that's more dangerous than we realized. Why exactly that is scientifically, we're going to figure it out.
We're going to walk this commercial break in.
Stand up, everybody.
Loops around the studio.
Yes.
I'll be watching that. Finally, a challenging job may be stressful now, but it could keep you sharp after you retire. A new study finds people with jobs that require skills like developing strategies and managerial tasks may be better protected against memory and thinking decline in old age. Keep the brain moving, right?
Use it or lose it, as they
building
say.
up the cognitive reserve and sense of community and social interaction is very important. I'll tell you, the take-home lesson from this is visit your parents, your grandparents, your older relatives. Just that interaction's important, keeping everything going.
So floss, walk, and talk.
Yeah.
That's what I learned today.
There you go.
I think someone taught me all that in the beginning. We just didn't pay attention. Dr. John LaPook, Dr. Holly Phillips, thanks so much.